Hi, my name is Emily Feiner. I'm the PA or physician assistant working at Pediatric Orthopedics UVA, and I work with many of the children with club feet. I created this video to help families learn some tricks of the trade and understand some of the challenges with bracing that they may have at home, to answer questions that they may have that come up after their clinic visit. Bracing is a big adventure. When you first start with Clubfoot bracing, it's 23 hours a day for the little babies, which is a significant amount of their time. And it's not going to be comfortable for the first 2 to 3 days, so do expect that. Make sure that it's okay with your provider, but majority of babies, we recommend Tylenol every 4 to 6 hours for the first 2 days, sometimes the third day. Again, make sure that that's an okay medication to take for your baby. There's many sensations that are new to the baby. For example, they're now bending their knees in the braces. They couldn't do this previously in a cast. Their skin is very hypersensitive. It's not been touched for many, many weeks, and now it is being touched. Their skin's exposed to temperature changes that it wasn't previously. There's a lot of changes for the baby, and just be patient because it will improve over time. As far as these socks, you can use a number of different types of socks. There's no perfect sock for all babies. We provide Black Robin socks sometimes, which is a double layer. Some families love those and they feel that they're very helpful to prevent slipping of the braces or skin problems. However, other families go with socks that are just one layer. They may pick them up at their local department store. You just want to ensure that the socks are tall and they go up high on the shin, and that they fit the foot without any wrinkles. You want them to be pretty smooth so that you don't have wrinkles underneath of the shoes. 100% cotton socks work the best. Polyester usually allows for more sweating, and therefore baby is more likely to develop a potential yeast infection under the sock. Ensure that when you put the socks on the baby that they're not real tight up against the toes. I've seen babies become uncomfortable because the family's pulling the sock on too tight. So I usually put the socks on and then I tug at the toes a little bit to make sure they have wiggle room for their toes. Skin problems can be an issue in the very beginning of bracing especially. The most common areas of irritation are at the front of the ankle where the middle strap goes across, and at the back of the heel. Do pay attention to the back of the heel because I feel that that's an area families aren't typically looking at when they're holding their baby or spending time with their baby. Most people are looking at the front of their baby, so do check the back of that heel and make sure they don't have any blisters, etc. Lotions. Don't use lotion on the legs or the feet because lotion creates a moist environment which can breed yeast, and then you start to have skin problems. Also, using lotion can promote slipping of the braces, and we don't want that. When you're bathing your baby, make sure that you clean in between all the toes with soap and water and dry those areas very well prior to putting on the socks and the shoes. Tricks of the trade. So if you are starting to have some skin problems, please call us. There should be phone numbers in your after visit summary for the nurses, and you can always reach them typical business days, business hours. If it's the nighttime or a weekend, you can always call UVA Hospital to the orthopedics person on call. That's definitely an option. If the baby has some redness or skin irritation, especially around that middle strap, that's normal. Do expect some of that. But if the skin really looks raw and red and as if it's blistering, that's a problem. And if the skin's breaking down. And usually babies will also be very upset and unconsolable if this were to happen. Don't hesitate to stop bracing if that happens. A clubfoot will do fine after a day or 3 if it needs skin to heal. So don't panic about stopping bracing for a short interval of time. Going back to the skin, make sure that you're checking it routinely. The orthotists, when they give you the braces, they will advise routine checks for those first few days. every couple hours, etc., just to make sure the skin is okay underneath of the braces. If you're getting too much skin irritation after 2 weeks, right at that middle strap, there is an option of crisscrossing the top 2 straps to create an X, and then the strap over the toe you just leave where it originally was. The X just makes the pressure point over the front of the ankle a different area, and sometimes that can really help with that one pressure area at the middle strap. Again, I would not recommend this unless you're having problems with that skin area after a couple weeks. Whenever you're changing diapers of the baby, moving the baby from here to there, please don't pull on the bar or the shoes, because that promotes slippage of the entire thing. So just be careful of tugging too much on those shoes and the bar. If you're finding that the baby seems okay and comfortable with the shoes on, but then you go later to put the bar on and they are very unhappy, one way you can ease them into bar use is place the bar when they're sleeping. So that's an option. And then when they're awake, it's already on. It's as if they never knew the difference. Sometimes that's a nice way to work them into the bar. And speaking of which, if you're having slippage problems with the bar and shoes, know that sometimes it's just the bar that's contributing to the slippage. So for example, if you have a baby that their left foot keeps slipping up out of the shoe, know that first of all, you need to give us a call and let us know. But second of all, it's always better to wear the Clubfoot shoes with no bar than to wear nothing at all. And I try to make sure families understand that because the shoe is helping with that dorsiflexion or stretching of the heel cord, even if there's no bar in place. So again, shoes is better than nothing at all. The straps on the shoes are made of leather, and you may find over time that you need to tighten it a little bit because the leather stretches out, or perhaps there was some swelling in the foot that now has gone down after a week or two. And so that's possible. I just wanted to ensure that families knew that the settings can change on the straps. Also, it can go the other direction. The baby can grow and suddenly you find that you're needing to lengthen the strap. They can't get to the same hole. That's okay. The other thing that I wanted to mention is when you look at the shoe, the Clubfoot shoe, there is a window in the side of the shoe where you can see the baby's heel. Now, I've had some families perseverate on this window and worry that the heel is not all the way down and completely flush with the base of the shoe. Oftentimes, it's okay if that is the case. If you have done your best to pull the foot up, ensure that the heel is back and down, secured your straps, calmed the baby, double checked everything, make sure heel's down, and it still is not flush with the base, that's okay. Over time, often what will happen is the child's heel will sort of drop and eventually it will be flush with the silicone base of the shoe. So don't get too caught up in that little window that's on the side. And if you have any other concerns regarding bracing, again, feel free to contact our nurses Monday through Friday. They do check their voicemails and they're happy to call families back and discuss cases with us that are families who are having difficulty. But hopefully this is a good adventure for you and your baby, and after you get through that first week or two, they can be quite comfortable. I see many happy babies here in clinic wearing bars and shoes. And remember, by the time they're around age 1, majority of babies are only bracing at night, and in the day they're walking and they can wear any kind of shoes that they would like. So hopefully this was helpful, and we'll probably see you in the future. Take care. So now that we've discussed skincare for the baby, we're going to move into bracing, up close and personal. This is called a Mitchell shoe. It's one that we commonly use here at the Battle Building. As you know, bracing starts out with 23 hours a day, so we need to make sure that the braces are placed appropriately. You'll notice that this has 3 straps, the middle strap being the most important because this strap functions to really hold that heel down and into place. The other straps are important as well, but they're sort of, I think of them as the secondary straps. This is the primary. This is a little window where you can see the heel of the baby once you get it down into the shoe. Recognize that the heel will not always be completely flush with the base of the shoe, and that's okay. I will talk more in detail about that later in this video. So now we'll discuss actual application of the shoe. So on this mannequin here, we have a Black Robin sock. It's just one brand, but there are many brands out there. Again, when you're looking for socks for the baby, you want to make sure that they're tall on the shin, and you really want the sock to be flush with the skin. It may not be perfect, but you don't want a lot of wrinkles. Technically speaking, this sock is too large for this mannequin. So a few things when you go to actually put the Mitchell shoe or the Clubfoot shoe on the baby. You always want the baby's knee to be bent, and most importantly, you want to make sure that you drive the foot upwards towards the shin, because that's going to enable you to get the heel down into the shoe. If you simply put the brace on while the baby's foot is down, you're going to struggle getting the heel into the base of the shoe. So again, dorsiflex the foot just like this and hold on to it, and then you're going to apply the Mitchell shoe. I'm continuously keeping pressure right here at the front of the ankle because that is what will keep the heel down. I'm going to bring the tongue of the shoe across, again trying to avoid wrinkles. Have that tongue nice and flat, bring the middle strap over, continuous pressure right there in front of the ankle to keep the heel down, and I'm going to secure the middle strap over here. If the baby's crying, feel free to pick them up at this point and console them. And if they're doing all right, you can move on to your following straps. The one at the top. All of these straps need to be snug. Too loose of a strap can create more wiggle room and skin problems. Moving to the bottom strap. Not too tight at the toes. You don't want this to squish the toes together, but it should be snug, as I said. So this is the finished product. Again, you can see the heel down in the window. You don't have to be able to get the heel all the way to the floor of the shoe. You can see the toes are coming through the front, getting close to that, the front of the white silicone, but not over. One of the things that some families prefer is bringing the sock down over top of the shoe. You don't have to do this, but if you feel the baby's more comfortable that way, you can do that. Next, we will move on to application of the bar with 2 shoes. So this is a bar that we use in clinic here. You can see there's a right as designated by the R, and there's a left side. So that's for the right and left foot. We will preset these to a certain degree so you won't have to worry about the rotation. There's 2 screws that hold these in place. If they ever get loose, feel free to tighten them, but hopefully that's not a problem for you. The width of the brace is determined when they are fit for the shoes in clinic, so you don't have to worry about the width. So this is where the bar will be inserted into the shoe. So it's just a simple click mechanism. You just slide it in. In order to take it off, you would simply push. There's a little lever that says push here, and then slide out. But again, we're putting these on, so slide it in. Other foot. Slide the shoe in. And now you have bar and shoes together on this baby. Some families ask about bar covers because once the baby gets super active, sometimes they'll bang against the crib with this piece. There are covers that you can purchase that have a little bit of foam to them and maybe a cotton cover. You can find them online, or some families use a pool noodle that they cut longitudinally and just put a section of it here with some duct tape around it, and that's fine. We discussed previously how skin can be a problem under this middle strap. And so if you've gone through 1 or 2 weeks and you're really having a lot of problems with that, or if slippage of the bracing mechanism is a big problem, you can crisscross these 2 straps. Again, I don't suggest this for most families unless they're having some problems with slippage or skin. So you wouldn't do this with the bar in place, but it would create an X over the front of the ankle. All the same rules apply. You would continuously want to maintain pressure over this area of the ankle to keep the heel down as you secure the top 2 straps. I'm not going to fully complete this, but I'm just going to show you how they would crisscross. There is no perfect design. Some families ask, do I need the top strap, overlying the second strap or vice versa? That doesn't matter as long as you have your X. But that's basically bracing with both shoes and bar for the child with clubfoot.